This video covers all things tissue expanders. Are they as uncomfortable as people say they are? What do they look like when you're wearing clothes? What do they feel like? What type of bra do you need to wear? And what is the expansion process like? Let's get into it. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. What exactly are tissue expanders? They're kind of like a deflated implant to start out with. Then over time, they're expanded, and then this helps to stretch the skin tissue, sometimes the muscle as well, to make room for an implant. You can think of them as a placeholder for something more permanent down the road. During the expansion process, the tissue expanders are filled generally with saline over a number of weeks. What are they made of? The outer shell of the expander is made of silicone, but they definitely don't feel like the silicone you would imagine that implants feel like. I was able to hold a sample of one at one of my plastic surgery appointments, and I was pretty surprised at how just thick and dense that it felt. Does everyone with implant-based reconstruction get these? No. Some women have a one-stage reconstruction called direct to implant. In this case, the implants are placed at the time of the initial mastectomy, and they don't have tissue expanders at all. Tissue expanders are only used for a two-stage reconstruction. This is what I had after my double mastectomy. The tissue expanders are generally placed at the time of your mastectomy, and then in another surgery down the road, those are swapped out for implants. There is an option to have the tissue expanders placed during a separate surgery after your mastectomy. This is called delayed reconstruction. Tissue expanders can be used for a single or a double mastectomy, and they can either be placed in front of the muscle or behind the muscle. There are many pros and cons to both of these, so this is worth looking into, especially if you're active. Tissue expanders can also be used for some types of autologous reconstruction, and autologous just means using your own tissue to make a breast or two. I'm going to be describing this process as it relates to implant-based reconstruction after a double mastectomy, as that's my experience. What type of expander size are you going to get? The size of the tissue expander is determined by your eventual size of your implants. You'll discuss your preferred final size of your implant with your plastic surgeon, usually at your first consultation appointment. The size of the expanders are also determined by the width of your chest. So if you're more broad versus slender, then that will affect the size of the expander. The expander capacity and eventually the implants are measured in cc's. So when you're determining the size, you're really just thinking about how that compares to your original breast size, rather than saying you want breasts that are 400 cc's, because what does that really mean? How does the expansion process work? The tissue expanders have a metal circular port that sits on the front of the expander. I was able to feel what this is like when I held that sample of the expander, and this was also much sort of thicker and denser than I thought it would be. The port on mine was right at the level of my mastectomy scar, which is just right at the middle. Some women have their ports much higher on the expander, so it just really depends on what type of expander your surgeon uses. The port is where the saline is injected to fill the expander. How does your surgeon, whoever's filling the expander, know where to find it? Because it is actually under the skin. They have a handheld magnet that they use. So remember, the port is magnetic. And so as they come closer to it, then in my case, they just put an X in the location where it is. The needle is connected to a syringe that has the saline in it. So sometimes you may just be getting one syringe full of saline, and other times you could be getting more per fill. It just depends on what schedule is sort of laid out by your surgeon and your expander capacity. The fill takes maybe a few minutes. I knew it was for sure more than 1 minute, but less than 5 minutes. The expansion will affect both the pocket, that's where the tissue expander is now and where the implant will go, and the overlying skin on top. If you had a nipple-sparing mastectomy, that means that you keep your skin over top of the breast and your nipple, then you may not feel as much of a stretch with the skin tissue when you're going through the expansion process. This would obviously depend on the size of the breast that you're choosing as compared to your original size. If you had a skin-sparing mastectomy, and so that means a lot of the skin tissue is maintained, but there's an oval incision around the nipple, and then that is removed and then sutured together. So then you will likely feel more of the expansions, feeling a tug in the skin, because this will need to be stretched more. If you had a double mastectomy, there's sometimes a difference in how much skin was removed from side to side. So you may notice that on your one side it feels quite a bit tighter than the other side when you're going through those expansions. And this was the case for me. What's the timeline for tissue expansion? Usually it's a fill every 1 to 2 weeks until you get to that maximum size of your expander. Everyone is different, but I had 4 fills over a period of 7.5 weeks. The timeline may change depending if you're doing radiation or not, and if you are, the timeline is sometimes accelerated. Here are the details of my expansion process so you can use as an example of what to expect. The first fill was at the time of my mastectomy and was 75 cc's. I knew going into surgery that the expanders were going to be filled about a quarter of the way. And I was pretty happy about this going into surgery because I was choosing reconstruction, meaning I did not want to wake up flat after a double mastectomy. When I woke up after surgery in the recovery room, I remember looking down at my chest and I was thrilled to see something that looked like breasts, what surgeons call a breast mound. The emotional piece of just having my breast removed really didn't come until after my exchange surgery, which was quite a bit of time later. When I was changing with the help of a nurse, when I was going home the day of my surgery, I was really more just curious when I looked in the mirror to see what I looked like as compared to sad at that time. Again, I think it helped that I had some sort of breast coming out of surgery, and I had also looked online at tons of pictures, so I knew a bit more of what to expect after coming out from surgery. The second fill was 2.5 weeks after my mastectomy surgery and was for 60 cc's. So this was the first fill that I was actually awake for. It does feel weird having a needle go right in the center of your breast and then literally looking down and watching them expand in front of your eyes. Does it hurt? Not as much as you think it would. As a part of the mastectomy, there are so many nerves that are cut, and so the sensation in your entire breast is really reduced. And I would say in that sort of central portion, that's where I have the least amount of sensation. So it really wasn't that painful at all for me. In terms of the after effects after the fill, at this point, I didn't have any significant tension or pain as a part of the expansion process. Some women do by this point though. It is normal if you feel any sort of tightness or any sort of pressure after each expansion. The third fill was 2 weeks later and it was for 60 cc's. I saw a resident that day and he said I was actually scheduled to have double the amount of saline, so 120 cc's. He did the first syringe, which was the 60 cc's, and my breasts were looking so big. And I realize this is all relative, but I did actually ask him not to do what was planned for the rest of that expansion that day. I stood up to look in the mirror after the initial syringe was put in, and I just found with the change in size, I needed my mind to catch up with the physical changes. In terms of pain, this was actually the first expansion that I felt something afterwards. So I was fine during the expansion, and then as soon as I left the hospital, I felt like an acute sort of pain in my mid-back area. It was pretty instant, and so I was just pretty mindful of not doing much that day to let that settle down. It's not surprising that this was on the cancer side, which was a side that I had more skin removed from. So those tissues would have been much tighter going through the expansion process. The day after, I did actually get back to trying to use my arm just for everyday movements, as I knew it would help to reduce the tension and also reduce any compensations that would come from that. I ended up doing the recommended amount of saline for my expander, but the timeline was just a little bit longer because I didn't do the full fill at this visit. The fourth fill was the final expansion, and it was 3 weeks later. The plan for me was to start radiation in a few weeks from this, so it ended up that they only expanded my right or cancer side. There's concern that the radiation beam that would be aimed at the right breast would penetrate the left breast in the process. So if they keep that left breast smaller, then there would be more of a clear path to get to the right side. I was a bit sore after this expansion, and this time it lasted just for about 2 days. My breasts at this point did for sure look uneven because I didn't have the same amount of saline in the expanders, and it was like this for about 6 weeks. I had to wait until I was done radiation in order to get that left side filled to match the right. To make my breast look more symmetrical under clothes for that time period, I ended up with all my bras, you know how they have those inserts in them, so on the side that was not expanded as much, I kept the insert in on that side, and on the side that was fully expanded, I just took it out on that side. The next fill, so 4B, was just to catch up the non-radiated side so that I would have the same amount on each side. As a summary, I had 4 expansions, and that's for a total of 275 cc's. Sometimes, and in my case, they actually expand slightly larger for what the implant size will eventually be. They want to take into account some of the side effects of radiation, where there can be sort of a tightening and even shrinking of the breast on that side. So expanding slightly larger than what your final implant size will be will help to accommodate for this. How long are expanders in for? This really depends on your surgeon's preference and whether or not you're getting radiation. If you look this up online, you'll see quite a range of timing. If I didn't do radiation, my exchange surgery could have been as soon as 3 months after my last expansion. Because I had radiation, my surgeon recommended that I wait 6 to 9 months after that was completed. I was leaning towards doing it on the latter end of that timeline. I wanted to get stronger going into the exchange surgery, and also wanted to let some new symptoms settle down from radiation, like lymphedema and radiation fibrosis. My expanders ended up being in for 13 months, and some of that delay, like I said, was just due to me wanting to wait a bit longer, and then the other part of it was COVID. How about exercising through the expansion phase? Most surgeons recommend that you don't do any physical activity on the day of the expansion and also the day after. When I was about halfway through the process of expansion, this felt quite obvious to me that I shouldn't be doing anything in my upper body for the day of the expansion and the day after. After taking those 2 days off, I found that I was fine to continue exercising. Because my tissue expanders were under the muscle, I was limiting what I was doing in terms of chest exercises, not just for that 2-day period, but the whole expansion phase. Other than that, I really wasn't avoiding any other exercises as I went through the expansions. I think that keeping up with exercise really helped to reduce some of the compensation tension in my neck, shoulder, and mid-back area. What do tissue expanders look like? One of the initial questions I had for my surgeon before my mastectomy was, will these tissue expanders look like real breasts under clothes? I had heard that they look and feel different than your regular breasts, which of course they do, but that they also feel and look different than implants. Some people say with tissue expanders they look lumpy under clothes. For me, I found that under clothes they actually looked relatively normal. I was about a small B going into surgery, and then when I came out of surgery, I was probably about a small A with the expanders. Tissue expanders will sit higher than your original breast, but also higher than your implants. They tend to also have a bit more projection out. So what I found is that upper portion of the expander was just as full as the bottom portion, compared to a regular breast where the bottom portion would be obviously much more full than the upper. Some women with a double mastectomy can have a bit of an uneven placement of the expander side to side. So my cancer side was pretty central, and then my non-cancer side, the expander was much more lateral or off to the side. So under clothes and wearing a bra, it wasn't too obvious, but it was noticeable if I pointed out to someone. But without clothes on, you could definitely see a different side to side. What do tissue expanders feel like? They feel really hard and dense, and they don't move much at all. This is a gradual process, so after surgery, they didn't actually feel that hard, but by the 3rd expansion, it was much more noticeable. I was very conscious of how hard they felt, because if I was giving someone a hug, they literally felt like 2 hard balls under my skin. And so when I was hugging someone, they could tell because they told me. If I would push anywhere on the tissue expander, it really didn't budge much at all. So see how these are implants, there's a bit of give to them. It's almost like I was pushing into my shoulder muscle. There's a little bit of give, but it feels very dense. If I was doing any running or skipping or any sort of bounding type movement, There really wasn't much movement of the tissue expander up and down when I was doing this. As the months went on, I did find that the tissue expanders felt harder. You do kind of get used to them over time, like you hear some people say, but I found those last couple months a bit more uncomfortable than those earlier stages. On the radiated side, I did have some capsular contracture. That side was a little bit harder and also didn't move as much as the non-radiated side. Some people describe a vice-like sensation going across their whole chest area when they have expanders in. I didn't experience this to the extent that I've heard others do. I think the reason for that is that I had a lot of hands-on treatment throughout the process. I did self-massage in through the whole breast area, and I was pretty consistent doing the rehab exercises after surgery, and all of these things together will reduce tension. What type of bras work best with expanders? In terms of appearance, I found that tissue expanders don't squish as much when you're wearing a sports bra. I find they're prominent no matter what bra you're wearing, as compared to your original breasts, which tend to look very different in a sports bra as compared to an underwire bra. With sports bras, I ended up taking out those inserts in the bra about halfway through my expansions. I found that putting a relatively immovable breast in something that's structured, because the insert would make it more structured, just really didn't work. As for regular bras, I started out wearing one of those front closure sport type bras right after surgery for a few weeks, but I often went braless just because it felt a little bit better in terms of reducing tension in this area. You definitely don't need a bra in terms of support when you have tissue expanders in, because like I said, they don't move that much, so you're not really needing to sort of hold them up like you would with original breasts or even implants. Sometimes instead of wearing a bra, I would just wear a camisole under a shirt. I also found it worked well to wear bralettes because there isn't much structure to them, and if they did have any inserts, I would also take those out. You're generally advised not to wear underwire bras after surgery for quite some time, but even if you did wear them, they would be way too structured for these types of breasts with tissue expanders. Because I had some lymphedema symptoms kick in after radiation, I found this also changed what I would wear in terms of a bra. Anytime I was wearing a bra, and not a bra all day, just even like an hour plus, there would be an indentation where the bra was, only on the radiated side, and then there would be like a puffiness right on top of that. So that line of the elastic with the bra basically wasn't letting that lymph fluid flow through that area. For a number of months, when the symptoms were worse, I found myself I have some really sort of tight tank tops, and I would just wear this as my bra under a shirt because it went that whole way and didn't cut off in the center here, and so that lymph fluid would more easily flow when I was wearing that. If you currently have tissue expanders in and you're finding them uncomfortable, there really is a relief in tension like people say when you have your exchange surgery.